over 10 other ways that HMOs really affect and hurt patients, and so that you can clearly understand why, if you're getting dental insurance, to make sure you don't get an HMO. Number 1, the clinic will say that they're fully booked. Again, the entire goal of the clinic is to not see you. So they'll dedicate maybe 1 day a week for 3 hours to see HMO patients. And so clearly those 3 hours are gonna get booked months and months in advance. So they might be booked out 3 to 4 months in advance, where the clinic technically isn't booked out. They're just booked out in the one spot where they take HMOs. And that way they can prevent getting too many HMO patients, and they can say they're fully booked. Number 2, the first appointment must be booked way in advance. Again, because you're an HMO, they're gonna tell you you must book it way in advance so you can get assigned to the clinic and everything can be in order before you ever come in, making it difficult because, again, it's hard to always plan if you're in pain to know that you have to go to the dentist, waiting 1 or 2 months. You probably aren't gonna do that, so you're gonna go somewhere else. It's pretty unlikely for somebody to plan 2 months ahead to book their first consult with a dentist and actually not have any plans come up and be able to keep that exact day. Number 3, not doing work the same day. After you go in for the consult, they'll tell you the work that you need to have done, but again, because they're trying to avoid seeing you, they're gonna make you have to come in for another appointment, another appointment, another appointment to get that work done. Say you're in a bunch of pain, they aren't gonna be able to do it unless you pay an express fee or some additional fee for them to actually make some money, because their whole goal is to avoid seeing you. So they'll do the consult and then they'll tell you, okay, in 2 months we'll do that procedure, hoping that you'll just cancel in the future or have something come up and not even come in. Number 4, only doing 1 procedure at a time. You need 6 fillings. Here at our office, we'll do all 6 in 1 appointment. But with an HMO office, you need 6 fillings. That is 6 appointments, and each appointment's like 1 to 2 months apart. That means it might take 9 months to get 6 fillings, which at a lot of offices can be done in just 1 day. Number 5, the dentist might just ignore work you actually have to have done. You need a few small cavities, the dentist is just gonna ignore that because they get paid more when the cavities are bigger and you need to have a crown or a root canal. So the entire incentive for the dentist is to ignore small work, which is horrible. Prevention is very, very important. It prevents you from getting cavities, but unfortunately, an HMO encourages dentists not to prevent cavities from you. Number 6, the dentist will refer work. See, an HMO gives an extreme discounts for general dental work. But for specialists, many times it's very close, if not normal prices. And with referrals, you can almost refer almost anything in dentistry to a specialist. You need to do an extraction, you can refer to an oral surgeon. You need to do a root canal, you can refer to an endodontist. You need to do a deep cleaning, you can refer to a periodontist. You need a crown or a denture, you can refer to a prosthodontist. So as you can see, literally almost every procedure in dentistry can be referred to a specialist. And so that's another great way for a general dentist to avoid seeing their HMO patients, because they'll just refer out basically anything that they need to have done. Number 7, some HMO clinics will actually have specialists come into their clinic. That way they can still make money. So what they'll do is they'll have an oral surgeon come maybe once a week or once every 2 weeks, and anybody that has an HMO insurance and needs extraction has to see that specialist. Same with a periodontist. Anyone that needs a deep clean won't go to the typical hygienist or the dentist, they'll go to the periodontist. So again, so that they can charge normal fees that they charge at the specialist. And I actually worked for a clinic that used to do that took HMOs. It was crazy. I could clearly do the extractions, but if they had an HMO, I wasn't allowed to do the extraction. It had to go to the specialist. Number 8, making up procedures. That's correct. Dental clinics will literally make up procedures to make it so that they can afford to treat you. Again, the HMO prices are so low, and the dental clinic wants to actually be able to make a decent amount of money, that they will add all these pluses and bonuses to things so that they can make more money. Let's give an example. Normally you just do an extraction, but if the patient has an HMO, you only get like $10 for the extraction instead of like the $150 or $200 that you were expecting. So to make up for it, they'll say, oh, there's other things. I had to put some medicine after the extraction in the socket, so I'm gonna charge you for that medicine, which might be like $50. And I had to curette the socket because there was infection. So, normally that's not charged at all, but a curetting the socket might be $60, $70. So as you can see, you start doing this plus, and it becomes the exact same price if you have an HMO. It can be with deep cleanings, putting extra ointment in, it can be doing fillings, putting in desensitizer, putting the bonding in. All these things, again, with the normal insurance would just be normal. But here with an HMO, they just add these extra prices so that literally the price is the same with an HMO and without an HMO. Number 9, long treatment plans. Going on with number 8, because now instead of just doing a procedure, this procedure has 4 parts and you're charging for every single part, the entire treatment plan is going to look really long. So it's kind of crazy. These HMO patients will get like a 5-page treatment plan, which really, if you came to our clinic, we do the exact same thing and we put it on like 1 page because we're not going to have a plus, but we don't take HMOs. So you get this long, amazing treatment plan and you think you're getting a really good deal because you're getting so much work done because it's 5 pages and each procedure is not that expensive. But when you add them all together, it is kind of expensive. And so they kind of trick you that way. They make it look like you're getting a ton of stuff done when you're really getting the same amount of stuff as you would at any other dentist. They're just breaking out every procedure into like 5 parts and then just charging you, again, instead of charging $100 for that procedure, they're charging you 20 times 5, which is the same amount. So the long procedure can trick a lot of patients because they think they're getting more work done just because the treatment plan is much longer. And number 10, not giving you the correct fee. See, HMOs are very confusing. You can have 3 people that have HMOs from the same insurance and they all have different fee schedules. So a lot of clinics, they'll just pick the most expensive fee schedule. So maybe one patient's supposed to pay 20 for a filling, another's supposed to pay 60, and another's supposed to pay 100. Well, they're just gonna say, well, we saw that fillings were $100 with this insurance, so anybody with an HMO from that insurance has to pay $100. And it's the patient's responsibility to go look up the insurance codes, figure out the fee, and say, oh, no, you're overcharging me, it's only supposed to be 20 bucks. Again, it can be very confusing with insurances and with HMOs, and patients don't always realize, and they can actually be overcharged. But at the end of the day, here's the saddest part of an HMO. When I see an HMO patient, I can just tell that they have an HMO by looking at their mouth, looking at how they have taken care of their teeth and how the dentist has taken care of their teeth. Because things aren't done well, anything is done is super rushed, the fillings aren't well done, they're just thrown in there like quickly, and because they're done so poorly, cavities have formed around those fillings because a bad filling is even worse than doing the filling usually in the first place because it catches dirt and plaque and makes it really easy for you to get a second cavity. And so it's just frustrating because you can tell that this patient has had horrible dental work and horrible dental care, and you can just look at them and know they have an HMO. So if you want a dentist to actually care about your dental health, and if you care about your dental health and you don't want to be scammed, please never sign up for an HMO.